Hello, this is Dr. Greg Mendel, your friendly anatomy professor. Today we are talking about the skin and the integumentary system, which includes the skin and vessels and receptors and all the different parts and pieces that allow you to feel and sweat and the hair and the whole bit. Let's take a look. So, why does this matter in the first place? Well, because people have skin. I know that sounds weird, but if you're going into healthcare, you're going to notice skin before you notice any other body parts, right? We're walking around with these meat suits covered in the integumentary system, so we need to learn about it. The other thing is people can injure your skin. You can get cut, you can get burned, you can get scraped, you can get bit, you can have infections. It's kind of an important thing. The other thing is the skin is your largest organ. That's right. What else is cool about the skin? Let's talk about this today. Vitamin D. You know, vitamin D is the sunshine vitamin. Without vitamin D, you can't build healthy bones, right? Vitamin D is why calcium can be absorbed in the colon to keep your bones strong. And without sunshine, you have a lower level of vitamin D a lot of times. Vitamin D is a great vitamin that helps actually, they believe, prevent cancers and some other crazy diseases. So, what about this slide? What we see here is it says media player, blah, 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 blah. This is a little ADA compliant video that talks about why skins matters in healthcare. All right, so what we're looking at here, ladies and gentlemen, is the things in the integumentary system. Now, we talked about skin. Yes, we talked about that. But we sweat. Why do we sweat? Well, we cool ourselves with sweat. Now, you know that. But the other kind of sweat you don't think of is pheromone sweat. So that means there are two different types of sweat glands. We have eccrine sweat glands and apocrine sweat glands, and we'll talk about those. The sebaceous oil glands come out where right here the hair follicles come out. Why do we have oil on our skin? And the reason is because it keeps the skin moist and conditioned and doesn't dry out as well, or as easily, I should have said. Doesn't dry out as easily. Sorry about that dinging sound in the background. I got to turn my phone's notification off. Next, fingernails, toenails, right? And then subcutaneous tissues. What is that? Well, we're going to get into that pretty deep here. We're going to talk about the veins, arteries, fat, the glands, and all these different parts and pieces. So we have different parts of the skin, two layers, actually partial layers of this one too, but the epidermis is the outermost layer. In thick skin versus thin skin, it's different. Now, what do you mean thick skin, Dr. Mendel? Well, if you look at the palm of a hand versus the back of the hand, you're going to notice it's a lot thicker. You look at the back of your hand, you'll probably see hair. You look at the palm of your hand, not many of you got hairy palms. Why? Because we don't, because it's a different type of skin. It does not have hair. And it contains a fifth layer as compared to thin skin, which has four. Well, what's the fifth layer? It's called the stratum lucidum. It is a translucent layer to help to attach the outermost layer called the stratum corneum, which is much thicker, by the way, in thick skin as compared to thin skin. So let's take a look. The next thing is the dermis. Now, there's actually two layers of this. They don't talk about it yet. I don't even know if the chapter does talk about it. But there is the papillary layer and the reticular layer of the dermis. The papillary layer contains the dermal papillae, which gives you your fingerprints, and also a pretty neat connection to the outermost layer. Now, we're going to go down in a little deeper, and it says subcutaneous. Well, subcutaneous is where we mostly have a lot of fat cells, and that is actually a very important thing because we have the shock and absorption and insulation of those fat cells. And we have muscle under that. So areolar connective tissue is why can't I speak? It's the tissue connecting everything together. And I'm sure you have heard me talking about that in the other chapter there with the different types of tissues. So now we have adipose, which of course is fat. Now let's take a look at this picture. What do we see? We see the epidermis, and I talked about the papillary layer. Right there is papillary. And you can see these bumps. These bumps are considered the dermal papillae. That is right, ladies and gentlemen. This is very different in every person, and therefore we have fingerprints in our thick skin because of the dermal papillae gives us our fingerprints. Here we see a hair. That should have made sense what that is right now. So we're actually looking at thin skin, and you're like, I don't have fingerprints in my thin skin. Well, it's a lot more pronounced in thick skin versus the thin. Now, we have the reticular layer, which is where that hair mostly is coming from. We could see in the reticular layer, we have these glands. This is sebaceous oil gland here. They don't show it very well, but that is an oil gland, and it secretes that oil coming out of the hair shaft. We have the hair root, bulb here, the root, the shaft, right? The hair follicle on the outside. We see there's a blood supply to every single hair. This is a living thing that grows, so it has a blood supply. You see innervation. Now here's the weird thing about hair. You touch the hair, you can feel it, right? You can feel if somebody just touches your hair, even if you have long hair, somebody messes with your hair, you can feel it because they're innervated. The hairs are innervated. We see a muscle here. That's called the arictor pili because it erects a pillar of hair. And so that muscle is a smooth muscle, and when it contracts, that hair will stand on end. Over here we see a Pacinian corpuscle, and up here, somewhere, I don't see them. Where are they? They're not there. There's a ecrin not ecrin, that's the wrong one. Meissner's corpuscle, but they don't show any for some reason on this picture. These are free nerve endings, which I'll explain. This is the ecrin sweat gland, which just sweat that cools you. And there's another type called apocrine, but I don't see any in here. And then down here in the hypodermis, we have our fat and our blood vessels. So it's mostly fat and blood vessels down here, fat and blood vessels, right? Let's go to the next slide is what I was trying to say. So we talk about different types of cells here. Keratinocytes. All right. So if you take and look inside or even feel the inside of your mouth on the inside of your cheek, you'll notice it's wet and squishy and soft and kind of yucky to some of you. You're like, oh, that's gross skin. If that were on the outside of you, you'd be like, that's gross. Why would it be gross if the inside of your mouth, the outside would look like that? Well, one, we're not used to seeing that, obviously. But the other is, it's kind of prone to opening infection, right? And you're like, it's not as protected. It's not so waterproof. It's not so roughened. It's kind of soft and yucky. It looks like raw meat on the inside. And that's right, because we don't have these keratin from keratinocytes. Keratin is a waxy protein buildup that waterproofs your skin, that gives it resistance, basically, from abrasion. It kind of roughens it up a little. Could the inside of your mouth ever become more like the outside of your mouth? In other words, can you keratinize the non-keratinized skin? And the answer is yes. We see that all the time. We see that all the time in baby boys where they cut the foreskin off. And the head of the penis is actually a non-keratinized skin. And because of the abrasive forces of their diaper rubbing and their underwear rubbing against it over those years, it becomes keratinized is what I'm trying to say, to protect it. Now we find this keratin starting in the stratum basale and working its way up. I'll show you those levels. Let's go to the next one, melanocytes. Now this I like. Why? Because I like to go to the beach and I don't like to burn. I also kind of like when people go, wow, you got a nice looking tan. And a lot of us enjoy having a tan, and they think we look better with a tan, right? And some of us do, and they called it that healthy glow. But the truth is that we are displaying the damage from ultraviolet light. We are displaying our bodies trying, the protective mechanism trying to protect us from that ultraviolet light, right? Because what we see is that the melanocytes will secrete melanin and make us look darker color because it's trying to guard against the ultraviolet rays of which we have been exposed. And so that's a true thing there. Dendritic cells we'll talk about a little bit later. That's not really the most important one here. That just sounds, well, let's just talk about it. Dendritic cells. Dendrite is a part of the cell that picks up sensation. It is the feeling part of a nerve that picks up sensory stimulus. So dendritic cells is we have the ability to feel things. We could feel hot. We could feel cold. We could feel dampness in the air. You can feel ambient temperature approximately. You can kind of guess how warm is it out here because we feel that on in the air. But tactile epithelial cells, what is tactile? That means our ability to feel with our hands, like to palpate things. We could read Braille with tactile sensations. Again, hot and cold and that sort of thing. But this is specifically like what can you touch and feel? And so that is those cells. So now we talk about those layers. Now from the outside in, this is the basement layer, so this is at the very bottom. I'd like to flip these around. Let's imagine that this is the underside of your arm. This is very outside. This is closest to you. This is more external. That's more deep, the basali. Let me see a better picture because I don't like it in that order. Let's see if we have a... Yeah, let's get... Well, that's not a great picture. We'll use it. All right. So here is the stratum basali, but the basali. Now remember, this is dermis. And do you recall the inside? What type of tissue is on the inside of the dermis? That's right, ladies and gentlemen. That is a dense irregular connective tissue right there. This is the dermis. We're down in the reticular layer, but up here in the papillary layer, we're seeing the dermal papillae, the papillae. Now this happens to be thick skin. I know this is thick skin for a couple of reasons I'll explain. One, you have a thick stratum corneum. Two, you don't see a bunch of hair. Right? And these would be fingerprints or toe prints, if you would, because it's on your hands and feet where you're seeing thick skin. So when we look at this, we see that this dark layer here is called the stratum basali. Basali. What does basali mean? It means basement. That's the basement layer, right? Now these are rich with melanocytes. There's a lot of melanocytes in there. That's where they come from. These are very alive cells, and they also are secreting keratin. Keratinocytes. Keratinocytes are mostly here in the stratum. There's more of them, at least, because there's a lot bigger area. But this is called the stratum spinosum. Stratum spinosum. So the spinosum, we have a lot of keratinocytes. We have rapid reproduction of these cells. And so we're making a lot of new cells, and we're pushing them outward in that direction. And they make a lot of keratin. So the keratin will kind of like stick in this area first. And this is called the stratum granulosum. And I like to think of it as it's so heavily granulated with granulocytes that it makes it look a little darker right there. All right. Now then we have a little layer you don't really see, but you can see a little white layer there. That's the stratum lucidium. And it's lucidium you don't really see because it's translucent. They call it lucidium because of the translucent ability. It's clear, basically. And then we have dead. These are dead cells. These are called stratum corneum. Now these are now dead. Now this is stratified squamous epithelium, multiple piles of flat cells. And eventually they flake off when you scratch or you get dandruff or you get like just dry skin or whatever. And it becomes that's right, household dust. You're like, wait a minute, household dust is not from me. Why, yes it is. A lot of it. Unless you just got windows open in a really dusty environment, right? Some of your household dust is from your own skin flakes. Kind of yucky, huh? But that's the way it works. All right, let's go to the next slide. Well, let's go back here and make sure we didn't miss anything. There. So we talked about keratinocytes. We said that keratinocytes, we are making keratin, which is a protein coat, giving it a protective property, as we said before. Melanocytes, and we said it makes melanin, which is giving you the ultraviolet tan, and we said that we get the tan to help protect keratinocyte nucleus from UV damage. We said it's to protect you, and we're actually protecting your skin's ability to make keratin too. And if we damage the skin from ultraviolet light, we can end up with weird things like spots and discolorizations, and then eventually possibly burning it too. And we'll talk about burns. But the other is cancer, and you definitely don't want that. And skin burns, from sunburns, can lead to cancer. So dendritic cells, we talked about basically in the epidermis, we are having some cells in there that pick up information. I probably misled you a little bit and I was kind of describing the tactile. These are also macrophages. And when we see in the nervous system chapter talking about these, you'll see a whole lot of that acting immune system of the skin. So let's go down to the 5 layers again. And we said that we see them all over the place. Thick skin, again, palms, soles of your foot, fingertips, the ins or the anterior aspect of your hand there, the inside there of your hand. So thick skin has the extra layer, which is called the stratum lucidium, and that is absent in thin skin, as I said. And also the one thing that the stratum corneum is much thicker in thick skin. They don't say that, but you just have to trust me. They don't really talk about that. All right, so stratum basali. Now, I said it's the basement layer, and I said we're going to see melanocytes. It says 10 to 25% of the layer has melanocytes, right? And I said they're rapidly dividing here, and it says they're actively dividing and making new cells, because we're always pushing cells out. Cells die as it moves towards the surface, and we said that by the time it's the stratum corneum, they're all dead, right? The stratum corneum is dead at that point. So stratum spinosum, and I said keratinocytes here, and it says there's a pre-keratinocyte site, pre-keratin filaments, and keratinocytes appear to be spiky, which gives it the word spinosum. I've never noticed that spiky appearance. I've looked under a microscope for 20 years, never noticed any spikiness. I don't know where that comes from. All right, granulosum. I always said it feels so heavily granulated, or it looks so heavily granulated they get colored, and they say basically the keratinocytes are very active here. Actually, it says it begins, so I think I misled you a little because I said in the spinosum. I apologize. I don't want to re-record everything, but I could, but let's just take my apology here, all right? I said the spinosum is where it starts. It actually starts in the granulosum. Some authors disagree, and Seeley and some others say different things. So the cells above this layer, and again, I said this, they die. Why? Because they're eventually going to slough off, right? And why do they die? Because they're away from the capillaries. Remember that capillaries are down in the in the dermis, not in the epidermis. All right, so now we're at the stratum lucidium. I said it's clear, and again, only found in a thick layer, and it helps to connect things together. It's kind of like the glue, right? And stratum corneum, up to 30 rows of these flat, stratified squamous epithelium. They don't tell you that, but that's where it is. It is a stratified, flat, and then squamous, and squamous means multiple layers, and it's the epithelium. But they're keratinized, they're dead, they slough off, but I told you it's waterproofing, so it prevents water loss, right? And then it helps protect against environmental things. You could scratch yourself and you don't bleed because you have 20 some to 30 rows of flat dead cells, right? So there's your protection and penetration protection. All right, also it says biological, chemical, and physical assaults. What does that mean? Well, we said if your inside of your mouth can give you infection because it's like your skin is exposed, right? There's not a lot of protection there. So the stratum corneum is on the outside of your keratinized cells, protecting it, whereas the inside is non-keratinized. Here we can see those again. So we have the basale, spinosum. You can see where the color change happens. That's the granulosum, lucidium, and corneum. All right. So dermis is the next layer down, right? And we talked about all these things that's in it. We talked about the papillary and reticular layers of that. You can see this is the dermis, which is the dense irregular connective tissue. Remember, that is strong in all directions, not just one. And we talked about the papillary versus the dermal. The papillary layer versus the deeper reticular layer. So let's talk about the papillary layer a little more here. It says that the papillary dermis is interlacing collagen and elastic fibers and blood vessels. Okay, so what the heck does that mean? Well, what they're saying is areolar connective tissue. That's what areolar connective tissue is. Remember, it's elastic tissue, it's collagen, and it has fibroblasts. They didn't mention that here, but areolar connective tissue has fibroblasts, and also elastic tissue, and so it's kind of like a glue layer. It's the connection layer. It's the layer that's under every layer of epidermis, and blood vessels are in there, and it allows for nutrition into the epidermis. Because remember that stratified squamous epithelium don't have blood vessels. So this is where the nutrition is coming from. This is considered also the basement membrane, is another way of explaining this. All right. So then when you get into the deeper layers here, we talked about sensation. We talked about Meissner's corpuscles. That's the one I couldn't find. But I want to talk about those. So this is nerves. We also talked about friction ridges. Now, those friction ridges, I said that they interconnect the dermis and the epidermis. It is the dermal papillae, right? We also said that it gives us our fingerprints right there, fingerprints. So it's very unique on every person. And we can see those here. Here's rows of those, what they're calling friction ridges, right? So the deeper layer, the reticular layer, is where we have most of the hair. We have the sweat glands, the oil glands, the sebaceous glands, all the stuff there, right? And so this is a very blood vessel rich vascular network with the miniature organs there that are providing oil and skin and hair and that kind of thing. All right, so ignore that. And here you can see that we have like this cleavage lines all over the skin. It's just basically lines. It says externally invisible, but it basically shows where your reticular layer is running in parallel to your skin surface. And I am not a surgeon, so I can't pretend to have this kind of knowledge. I've cut up cadavers, but they don't heal, obviously. But apparently some surgeons are trying to cut along these parallel with them so they can heal better. And I think any parallel cut of skin would be better than a perpendicular cut. Perpendicular cuts will obviously not heal as well if the skin runs in these patterns. So minimizing scar tissue is the purpose here. All right, so we actually have these as we talked about, these cleavage tension lines right there. We have flexure lines, which is where the dermis is secured to deeper structures. Now, this is also a areolar connective tissue, but it allows your skin to attach. Some people call this the fascia layer also. All right, so we could see these deeper grooves here, which some people might call wrinkles, but really they're called flexure lines. Why? Well, that's where your hand folds, right? And it flexes there all the time. And I know on the internet you're like, oh, if anybody has the M structure inside their hand, they're special. Everybody has the M inside your hand. Don't fall for any of that stuff. And you can see them here too. It's where the bending occurs here, right? So that's where we're going to have easy joint movement, right? And it gives you deep creases, but that's inside your fascia. All right, so can you have a boo-boo? Yeah, if you can stretch out skin, you get stretch marks. If it grows too quickly, we have a whole different slide on dermal tears. And also the other thing is you've probably got some walking incident of wearing some ill-fitting shoe that rubs your foot weird and you end up with a blister. Or you decided to swing the axe handle a couple times without wearing gloves, and you can actually tear the epidermis away from the dermis. It fills with fluid because the areolar connective tissue between the two is an excellent fluid holding environment, and it'll give you this fluid-filled blister. Don't pop them, And here's that slide that we talked about, the stretch marks. And again, a stretch mark is simply a torn dermal tear, and it gives you, it kind of heals with scar tissue, and it happens to everybody. When we're young, we grow fast. I have stretch marks from growing fast. I'm well over 6 foot tall, and I had a growth spurt. Your body can only grow so fast. We talked about getting tan. That's the melanin. So these are one of the pigments, and so melanin is produced by the melanocytes. We know that it helps prevent from ultraviolet damage. The more sun that we get exposed to, the more protection we're going to need, and therefore more melanin. If you see people that go to the beach a lot or live down by the beach, they have a pretty darn dark appearance, right? But the only bummer is if you over-tan to help force this, your skin can get thicker. Now why? Because it'll get leathery. If you see those sun worshippers are out there too long, they're not just tanning themselves, they're truly tanning themselves. So what do you call a tanned skin from an animal? It's called leather, right? So are you turning skin into leather from the sun? Not exactly, but it does tend to harden and thicken and over a long period of time. Skin color difference are due to amount and how much melanin we have. So if you have a friend that has a darker skin than you do or lighter than you do, it's just because you have different melanin levels. Even people with really dark skin will have areas of which melanin may not be producing, and then you have different discolorization of the skin. I actually just right now forgot the name of that, and I can't think of it, but we will in a little bit. But my little boy has got all kinds of freckles all over his face. Some of us have moles in different places in the body, and it's different accumulations of melanin. So some people believe that moles are precancerous, right? And I don't think that's exactly what's going on there. But we can have too much skin exposure to sun, and it says right here, causing skin to become leathery. Why? Elastic fibers will clump up if you excess expose. It will actually decrease your immune system temporarily if you have too much sun. And then, as we said before, it can change the DNA that may lead to skin cancer. We didn't talk about DNA, but skin cancer from ultraviolet light. It also it destroys folic acid, which we need for DNA synthesis, therefore altering your DNA. So, not a good deal. So the other thing, though, is what is folic acid? That's the thing you take in a prenatal vitamin, and it says developing embryos. It's because it's for neural tube development. So you don't want a kid with like catecholamine, not catecholamine, what is that called? I don't know why. I can't think of it. I'll think of it in a little bit. But anyway, their spinal cord, I cannot think, something occulta. Spina bifida, that's the word I'm looking for. Spina bifida occulta versus, there's one other one. But there's two different types of spina bifida. And anyway, we think that is caused by not enough folic acid. Any young lady in the birth range who's sexually active should be on a multi vitamin with folic acid. It's a prenatal vitamin. And some young ladies say it's one of the best vitamins they've ever taken. Some of us, especially like redheaded people, become photosensitive, and it increases your reaction to ultraviolet radiation. Redheads are kind of known for white skin and easily burning. So that is a real deal. The other thing is there's some antibiotics and other medications that cause you to have an increased chance of getting sunburn. All right. So what is keratin? Keratin is a pigment which actually you can get out of carrots. I know it sounds dumb, but if you decide carrot juice is my absolute fave, I must drink carrot juice every morning, you're going to end up looking like you're jaundiced, honestly. It's a yellow-orange pigment. It will build up in your skin, and it helps with making vitamin A, which we know is good for vision, and that's why we make jokes about rabbits eating carrots and having great eyesight. Well, how do you know that? Because you never see rabbits wearing sunglasses. Ha, ha, ha. I get it. Yeah, right. But that we know that vitamin A is a big deal. Why? When we talk about the eyes in anatomy part, or it's actually later in this chapter, so it's vision. Vitamin A is necessary to convert rhodopsin from the rho and the dopsin. It creates rhodopsin. When you build up rhodopsin, you could see in the dark. And you cannot do that without vitamin A. So people that have a vitamin A deficiency develop night blindness. We saw it a lot in the soldiers in World War I and II, and that's when they start figuring it out. So hemoglobin, and we know that hemoglobin is in your blood, right? And it helps with oxygen transportation. But if you have very fair skin due to lower levels of melanin, you can actually get a pinkish appearance, right? You kind of look pink skin because of the hemoglobin. It's more transparent, right? And little kids are more pink. They come out kind of pink, right? So if you end up with blue skin, low oxygenation. I remember I had a little brother kind of had blue colored lips while he was in the swimming pool. And I thought, oh, that's because he's cold. But he was just basically not breathing because he was so freaking cold that he actually started getting kind of a blue coloring. But when you see a patient in the hospital turning blue, that's not good, right? That means there's cardiovascular, cardiopulmonary, respiratory disease going on. So pallor, that means kind of like very pale, right? And again, low colored due to low hemoglobin and low blood. They also have low blood pressure, perhaps. You can turn pale. You can turn white because of emotional stress. We probably saw that over Halloween. You scare somebody so bad the blood rushes out away from their skin. Why does blood rush away from skin when they're scared? Well, let's talk about that. Fight or flight response. You have to shunt the blood to muscles to run or fight. So right there, your skin, not that big a deal. How do we turn red? You ever see anybody turn red? You pick on them enough, they turn red. Well, embarrassment can do that. Allergies can do that. Inflammation, fever, there's all other things. Here we talked about the liver and the jaundice. We talked about jaundice. You don't want to see somebody turns yellow, especially if their eyes have a yellowish color. Not good. Usually it's a liver problem. It might be biliary tree issue. It might be over drinking, things like that. And I mean by alcohol, not water. All right, so all these different colors, you could take a look at that. Brown, black patches, it's hyperpigmented, things can go wrong. If you see somebody turning, I've never seen anybody turn green or purple is a bruise, but I've never seen green. So what they're talking about here is a bruise. And so blood leakage from a blood vessel. If you bump yourself enough, you're going to end up this. I always think of blue and blackish, purplish, but I've never seen anybody turn green. After it's healing, I've seen them turn kind of yellowish, but more like brownish, blackish, bluish, purpley, I don't know, whatever you want to say there. All right, hair. Let's talk about hair for a moment. Hair is alive, as we just said. But remember, on keratinized cells, yes, but not in the thick skin. But we don't have it on our lips. We don't have it on our nipples. We don't have it on some of your external genitalia, like the head of the penis and the clitoris and that kind of thing. And so hair doesn't grow there. So when we said before, why do we have hair? And we said we could feel hair. And so you can feel a bug on you because they'll push through your hair trying to get on you. And we can pick up that information from hair, or we can pick it up just from skin. It says hairs on your head guards against physical trauma. The other thing is sunburns. I tell you what, you meet somebody that's lost some hair and you see them at the beach, they're putting sunscreen on top of their head. And I didn't think that was a big deal until I got a little bit of, severe exposure to sun. And even if like a guy cuts their hair short in the summer due to, it's hot. So I cut my hair really short one year, burnt the crap out of my head from sunburn. I didn't know you could even get a sunburn on your head because I always had thick hair and it was longer. But I thought, man, it's going to be hot. I want short hair. All right, protects against heat loss. When I camp a lot, and I'm a scout master, right? So I'm always teaching these kids. But there's a certain temperature, and you get down in the teens and the single digits, you better sleep with a hat on, not a baseball hat, but like one of those. I don't know the other term for it. The German term is Siffelkopf, which is a type of hat you might call it like I don't know what are those called, beanies. Everybody calls them something different, but I think of it as like a Carhartt hat. You know those ones I can't think of the name of what else they might be called, but it's like a sock hat kind of thing. I don't know, but anyway, they help prevent heat loss. We lose a lot of heat out of our head. Shield against sunlight. I just talked about that. Eyelashes. Shield your eyes. Okay, so an eyelash. What kind of eyelash you got to shield your eyes from the sun? I don't know, but they say it helps prevent sweat from dripping in your eyes. But that's eyebrow is what I'm thinking. But an eyelash is like they're very sensitive, and if you get something near it that might get in your eye, it might signal you to blink and keep it out. Nose hairs filter particles from inhaled air. The other is, you've got like not just nose hairs, but I mean hairs in your upper respiratory tract kind of thing. All right, not upper respiratory tract, but in your nasopharynx is what I meant. Like very upper, yeah, including your nose. So, as we said before, this is a collagen-based keratinized structure. I may not have said that, but it is. It's a keratinized collagen structure. So there's formulas that are called hair, skin, and nails, and it's mostly collagen. All you're taking in is collagen, right? All right, so hair follicles are producing these hairs, and you can rip a hair out by its follicle, but it'll grow another one. They always go, oh, you should wax, because the hair will always grow back finer and thinner. Bullshit. It's not. It comes back finer and thinner at first because it's growing. You just got a brand new hair, and that's why it looks like a thinner hair, but eventually it'll be the same hair, right? You yank a hair out, another one growing just the same. So you're just wasting a lot of cash there with electrolysis and things. They say it'll shock the hair to let go and it'll never come back. That's not exactly true. Now, laser can do that. Laser is your way if you want to remove hair permanently. Yanking it out isn't going to fix it. Shocking it to death before you pull it out isn't going to fix it. But laser actually can. So that's kind of a interesting thing. So keratin is kind of a harder, tougher structure. It's durable. And so we know that our fingernails are this way too, along with hair. So we got the root, the shaft, and I called it the root, the bulb, the shaft, and I talked about the follicle. But what we didn't talk about is parts of the hair shaft. There's a middle, there's an outside, and then there's the cuticle, which is the very outside. So it's like middle, intermediate layer, very outside. No, I'm not going to ask you that. It's not going to happen. But there's different pigments of hair. You see some people are blonde, some are red, some are brown, some are blackhead, some are gray, right? And so actually what happens is melanin production decreases. After aging, melanin production decreases. And it says air bubbles replace melanin in shaft. That's interesting, right? The air bubbles will replace the melanin in shafts. So you stop getting the melanin and instead you put air bubbles and it makes it look gray or white. Pretty interesting, right? And that's one of the bummers that goes along with hair. Now, red hair is a little bit different. It's a different melanin called phenomelanin pigment. Quite a bit different, right? So redheads are different. There you go. All right, so, and no offense if you're redhead, I'm just talking about the color of the hair, but, there it is. Plus, they burn more. Their skin really has come on, anybody that's a redhead knows exactly what I'm talking about here. You're going to burn easier. All right, here's a cross-cut of the hair. Here we see the innermost layer called the medulla. And then I said intermediate, which is the cortex, and then the outermost, which is cuticle. And then we've got this outside area here that we're going to call the root itself, the root sheath. And the outside is that fibrous sheath on the outside. I personally am not asking you any of this stuff. They may in lab. All right, hair follicle. I'll do a quick review too on what kind of stuff that I think is going to be important here. Hair bulb, follicle, bulb. As we said before, the follicle is on the outside. It's kind of surrounding it. The bulb is basically the root where it starts to grow, at the very bottom, the deepest part, right? The root is the shaft growing out. It's not called shaft until it pierces through the skin. I wouldn't worry about any of this down here. We talk about basement membrane of the hair itself, and that is basically the bulb at the very bottom layer. All right, matrix and arrector papillae. All right, so as we said before, the arrector papillae muscle. This is a muscle, smooth muscle. And when you get cold, it'll stand on end. Emotional things stand on end. Different thoughts that might freak you out stand on end. Right? You had Halloween, hair can stand on end. And so as the muscle contracts, it just causes the hair to stand up, basically. As the hair relaxes, it pulls it back down. Right? So here you see all the different parts and pieces of the skin, more lab stuff than in his lecture. I don't know to what extent he is going to ask that, so I'm going to leave that alone. And so hairs go through growth cycles. A scalp is about every 4 years. Hair can grow to a certain extent, and then it kind of like, you have to cut it a little bit to get it to keep growing. It'll actually stop growing for a while. Eyebrows, it says only a few months, so they never really grow that long, right? So the lifespan is after a couple months, that hair will just fall out, and another one will grow in. On your head, and it grows about 4 years, and then you have longer hair, all right? And then it gets replaced by new hair. All right, so sometimes female homeostatic imbalances are not exactly the biggest part of this class, but they're interesting. I don't include these on tests. But there is a condition with females that get thicker, coarse hair, and it's called hirsutism. I don't even know if I pronounced it right. Hirsutism. Hers? I don't know. Hair-suism? I feel kind of dumb there. Pronounce it yourself. Sorry. But anyway, Polycystic ovarian disease can also give you some androgens. Now, what does that mean? It means like testosterone-like drug, and it will cause more hair development. And you may get hair in places you don't want, like your face. You may kind of get a little bit of that bearded lady syndrome kind of thing. And so some are like, well, just shave it. But that doesn't really fix it, right? So it's a hormone imbalance. If you can fix the hormones, hopefully you can fix the issue. I would think waxing would be better than shaving, if I were in that situation, but I'm not. I think that maybe these, I don't know, I see commercials for hair removal clinics with laser. I don't know, I'd be a little nervous to do that on my face. But I had a student who worked there at I think it was Milan Laser or one of those. But she said the laser is basically, it's computerized that it looks for a darker pigment like the hair itself, and it will send a little zap signal there and kind of fry the hair so it doesn't come back. All right, here's the shitty thing. Guys get a thing called male pattern hair baldness. Now, women can get it too. Women can also get this, but it's just common in guys. It is genetic. It is a male sex hormone influenced condition. Now, what does that mean? Male sex hormone, testosterone. Let me just tell you the truth. Testosterone. Let me spell this out. Testosterone aromatizes to something called dihydrotestosterone. Now, they don't tell you all this, but I will. Aromatizes to dihydrotestosterone. Dihydrotestosterone chokes out the hair follicle. It chokes it out, and it'll just kill that hair, and then it won't come back. So the higher testosterone you have, the higher chance of losing your hair. It's just the way it works. So when you see that guy going bald early, he's the studliest guy in the room. He's got a higher testosterone level, probably, right? But the hair follicle, it says it responds with androgens to decrease growth cycles, with decreasing growth cycles. The higher testosterone, the less hair you're going to have. Not on your head, but it'll grow on your body. There you go, right? Shoulders, back. Enjoy it, right? It's awesome. But drugs can inhibit the production of androgens or increase the blood flow to the follicles. So what are we talking about? Proscar, finasteride, there's a bunch of them out there on the market. The downside of those drugs, it might cause erectile dysfunction because it's messing with the hormones of the guys. You drop a guy's testosterone, he's not exactly happy either. So this is it's a no-win situation. It's just the way it works, right? But we see that after aging, people start to lose hair. The guys around their 40s start to lose hair. Mine's thinning. It's just the way it freaking works, right? It grows fastest in your teen years and your 40s. And when you're young, you've got such an amazing head of hair that you think, oh, I'll never lose my hair. Well, it could. It can. It's just the way it goes. Especially once those guys hit around 60, 65, it just happens. Right, so the only way out of this is buying the drugs at that point. It's just the way it works. So homeostatic imbalances. Again, I don't put these on the test. I'm not gonna bother with you, but putting those on the test. But could you have something else that causes your hair to thin that doesn't go along with what we just talked about? Yeah, a lot of things could go wrong with the body. Crash diets can starve you of enough nutrition, you lose your hair. Some people pull their hair out and just lose and shed hair due to stress. I have seen this with my dog. I'll leave my little puppy in the car with the windows mostly down. I would never do it with the windows up. I don't want my doggy to die. Those people should not do that. But I've left even nice temperatures, but my dog has separation anxiety. And I like put my dog in whatever area. Maybe it's a room in the house. And I come back and my dog's freaking out because I'm not there. And there's hair everywhere from this dog. So those little separation anxiety events even cause your dog to drop hair. Childbirth is just extremely difficult on a woman. I am just in awe of what women have to go through to make more people. And it's extremely hard on a female body. And I respect them 10 times more for even knowing how hard that is on them. And that they go through that and have to go through that to make another person. It's very hard on the human body. But one of the things is even your hair. A lot of things can go weird on there. But dietary deficiencies, definitely protein starvation and such, trying to lose weight quickly. Some medications can also cause this. Chemo is notorious for this. We have family members that went through chemo, and their hair just falls out. And thyroid will do this. In fact, you can kind of find somebody with hypothyroidism due to lateral, actually it's hyperthyroidism can do it too, will lose a lateral 1/3 of the eyebrow hair. And then when their thyroid kind of fails, they start losing a lot of other hair. It's kind of wild. Let's talk about fingernails. This is a hardened keratin, obviously a protective cover. But the other thing is it helps us to pick things up. I was trying to pull tape off of models we were labeling yesterday in the lab, and I don't have enough fingernails to even grab the tape. So that free edge is actually pretty handy to help pick things up. Let's talk about the fingernail for a second. The root is embedded deep inside the skin, and then it grows outward in that nail plate or body, and then the outside's the part that dies and continues to grow, and we trim it with the little clippers, or you use a little file, or whatever method you use. My kid bites his nails, which drive me nuts, but some people do that, right? And so that we know that nail bed is protecting, right, the skin underneath it, right? And there's epidermis underneath there. So the nail matrix, it says it's the thickened portion, and that is what causes the growth of the fingernail there. All right, cuticle. Cuticle is we have a cuticle, which is the skin. That's basically the skin from your finger kind of growing down on the top part of the fingernail there. That's called the cuticle there. They don't say that there. It says nail fold that projects onto surface of nail body. Well, that's not what I learned as a cuticle, right? I don't know. But anyway, the epipontium this is different. There's the epontium and epipontium. So that is the epontium is the same thing, epo or epontium, however you want to pronounce that, is the top part with the cuticle, and then hypo is under. And if you've ever had like a little splinter or something go up under your fingernail, my gird, that drives you nuts. But that's called the hypopontium. And some of y'all, they are mechanics and such, they get the dirt up under there, and mechanic hands, you could see those. It's pretty rough looking stuff, right? It tears their hands all up. So here we have the cuticle right there, and epipontium, and here is something called the lunella. What is that lunella? It means half moon, like a half moon or part of a moon. And lune means from the word moon. And you've probably all seen that people act weird around the full moon, and so people act nuts, and they say they're like lunatics, or lunacy is happening, and lune goes along with the moon, and they're saying they're acting crazy because of the lunar cycle, right? Foot's the moon. So lunatic, right? You see the moon makes a mess. Here's the hypopontium. You don't want a splinter up there. I got one up there the other day. I was working with some wood on the deck, and especially wood that has creosote, that treated wood. Oh my God, talk about a horrible possible infection, right? But nails can go wrong too. We can get yellow tinted nails. Sometimes that's a thyroid thing. Sometimes it's yellow and thickened. It's fungal infections and they peel off. You can have different things. Iron deficiencies will give you that. We see these things called Bowes lines or horizontal lines across the nail. And so not just the normal, but horizontal. And that can indicate things like diabetes, heart attack, chemo. I had that on a fingernail, and I freaked out. I was like, I'm going to die, right? And then, but it doesn't necessarily mean that. You can just, nutrition could be it also. I was trying to lose a lot of weight and didn't get amazing nutrition. But here's this one thing here. It's a spoon nail. It says a concavity. It's iron deficiency. Oopsie. There, iron deficiency. Now, wait a minute. There's something they did not mention. I wish they would have. No, they did not. All right, so there's another one. And I met this lady at Home Depot and ended up becoming a patient of mine. And I brought her into the clinic and I said, hey, I'm worried about your pulmonary issues that might be happening here. And she goes, well, what are you talking about? I say, if you have what's called clubbing of the fingernails. Now, the book doesn't seem to talk about that for some reason, but there's also clubbing of the fingernails. And they don't show Bowes lines either. So I'd like you to Google clubbing of the fingernails. And when you see that, that's usually a cardiovascular problem. Well, I told her, I said, I wanted looking at this deeper. I think you have a pulmonary disease. you smoke? And she goes, yes. And I said, okay, how much? It was like 2 packs a day. I'm like, you got to stop. That you're damaging your lungs. And I said, I think you might have emphysema, you may have COPD, you might have blah, 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 blah. And then I met her years later at Home Depot again, and she said, Dr. Mendel, it turns out you were right. You were the only doctor that noticed this. She said, one day I was so short of breath I couldn't hardly even breathe, and it turned out that I have a lung disease. And so she said, you caught this super early, except I ignored it. And if I would have listened to you, and it was cystic fibrosis. So this poor lady had cystic fibrosis, which requires some genetic testing, and that can be passed on to your children. And I was like, do you have children? She said, no. But I would like you to look up clubbing of the fingernails, and the fingernail will bow out like a little club, and that's what I call clubbing, right? But that is the opposite. It's the clubbing goes way out, and they get big rounded kind of fingers there. All right, so let's talk about sweating. Hey, this is the mean one here. Eccrine sweat glands, right? I was up at Hollywood World, and those of you who've never heard of the place, it's an amusement park like Six Flags kind of thing, and I slammed this guy while we were getting on the ride. I turned around and slapped into him, and I went, eccrine sweat glands, like like yucky, eek, So eccrine sweat glands, it was just a sweat. Some people call them merocrine sweat glands, don't know, because maybe they're American. So American sweat gland, right? Sweat gland on American. No, it's stupid, I know it, but it helps you remember maybe. But the eccrine sweat glands, those are ones that are just yucky sweat. But apocrine are the true merocrine sweat glands. And so these are located different places. What this is that's like your armpit and your groin. And you ever notice a dog wants to sniff you? They don't sniff your freaking arm. They want to go to, you're like, get away from there. We talk about these eccrine sweat glands, which are just sweat pores, and they do it to cool you. So you sweat to help cool your body. So it's thermoregulation, and so you sweat to cool yourself. It's part of the sympathetic nervous system. Here it is, apocrine. And let's see what it says. It says bacteria break down sweat, leading to a stinky. You notice your armpit and your groin area probably smells a little differently. But it also says, didn't say it. Why doesn't it? Well, it should. Anyway, pheromones, ladies and gentlemen. And so, sexual scent gland. Why don't I just call it pheromones? Why do I call it something weird? Sexual scent gland. Pheromones, ladies and gentlemen, is what Pher, pheromone, O-M-O-N-E. I don't know how to spell that, but Google it. Pheromones. They actually put it in people's colognes and perfumes to try to attract opposite sex. We put these off, and some people, it's kind of attract people to one another somehow. They just, I don't know, it's like a subconscious thing. So anyway, modified sweat gland, breast milk. Breast milk is a modified sweat gland. The mammary glands is a modified sweat gland. Your earwax is a modified sweat gland, and it's secreting cerumen instead of the watery stuff. All right, so now we're going to talk about oily secretions. Sebum can actually get is the oil that is being secreted from your sebaceous gland, oil gland, right? Sometimes it could be trapped, and then bacteria can get in there, and then they form like a whitehead or a blackhead, a comedo, an open comedo, and that whole thing. I don't know if you know what that is, but I don't know if you know if it's in this chapter. So here we have the eccrine sweat glands, apocrine, which are found in the armpit and your groin area. It's pheromones. They have to call it something weird there. And then a sebaceous gland, which is an oil gland. That's that one right there that's putting out oil on the hair shaft, right? So anyway, a little chart to hang on the wall in the bathroom. You get something to read, right? And anyway, we were talking about comedoes. Here it is. So acne. What is acne? Well, this is an inflammation of a sebaceous gland, and it results in something called a pimple, right? And some people call them zits because they're mean. And these things, they can pop. But if you pop them, that they go on the inside, that could be bad. Because then you push infection inside. And you can get that in a sinus cavity or under your skin and that kind of thing. So a whitehead is called a closed comedo. But once it's open the skin, and it's no longer blocked because it oxidizes. And then that white becomes dark because it's oxidizing. And then it's it's just kind of, that's the way it is. Now, then it gets infected and that kind of thing, possibly. and then you have a full-blown infection. They don't talk anymore, called an acne, right? A pustule with cyst. With pus, and pus is from bacteria, by the way. All right, cradle cap. What is cradle cap? Well, this is a overactive sebaceous gland on the scalp. It causes seborrhea, and it starts as like a pink raised lesions, and then it sloughs off as a yellowish dark. And there's cradle cap, and I don't know the treatment for that because I don't treat little babies. But the skin is our first line of defense for protection. We also regulate body temperature by shivering our muscles. We pick up the thermoregulation, which is picking up the temperature, and then we either shiver or sweat. Right? We feel things. We have our blood reservoir in our skin, and we excrete things like sweat, as we said. There's 3 barriers: chemical, physical, and biological. So first of all, chemical here. What are we looking at? And it says that we have sweat, which has antimicrobial properties. We have sebum, which we just talked about, and it kills bacteria. We also have an acid mantle. What is that? It says a low pH of the skin retards bacterial multiplication. In other words, it slows bacteria. Low pH. What is low pH? It's acidic, ladies and gentlemen. So acids basically kill bacteria, right? Melanin, as we said, to protect against ultraviolet damage. Physical. Well, okay. Some of us, I don't know how I got so lucky, but poison ivy doesn't do anything to me. Nothing. But some people, oh my goodness, my poor mother can't even get near poison ivy. If she walks past a yard of poison ivy and the wind blows in her direction, it seems like she gets it. Can that happen? No. She actually has to contact the oil on the poison ivy leaf, and some people get huge reactions to this. And if she scratches it, it seems to spread, and they get horrible reactions to it. So lipid base is the oil, right? Organic solvents like paint thinners, acetone can burn you. Lead, mercury, those are obviously very toxic to your body to get in your bloodstream. They're pretty yucky, right? And nitroglycerin can pass through your skin also. So there's limited penetration of these following things that can get in bad. You don't want to touch lead, mercury. Lead paint, retards your mental growth. It can decrease mental capacity. Some drugs, such as nitroglycerin, they put a patch on you that is a vasodilator and therefore helps give blood to the heart because it's going to arterial dilation and allows more blood to the heart. The other thing it does gives you a raging heartache. Headache is what I'm trying to say. So if you put on nitroglycerin and it doesn't help the chest pain, you're going to get a raging headache because it didn't dilate the blood for the heart. You probably just had some other issue like severe heartburn, but you're going to get a bad headache out of the deal. All right. Penetration enhancers. In other words, it says pharmaceuticals that help carry other drugs across the skin. There's DMSO and other solvents that will help drag stuff across. That's just the way it works. All right. Biological. All right. So we have antigens and immune system helping to prevent things. So something yucky gets on your skin, it'll kill it. Now, here's what you don't know. You have this thing called a flora. A flora is bacteria. You have about 400 variety of bacteria crawling on your skin. You're like, yuck, but it's a good thing. And it's a bad thing to use antibacterial soaps all the time because you're actually killing some of your good bacteria and you're not completely killing the bad. So if you don't completely kill the bad, it's kind of like if a guy goes to the gym for long enough, he gets stronger. What doesn't kill you makes you stronger. Now you get super bugs, super bacteria. I don't use antibacterial soap. Why? I don't want to create super infections, so I don't use this stuff. But that is a real deal. All right. Homeostatic imbalances, heavy metals. We talked about here. We said mercury and lead. Not good. Let's take a look. So some of these things, like these heavy metals, if they get in your body, kidneys shutting down. Brain can be damaged, especially as a kid, because as a kid, your brain is still developing, right? So you want to, and they used to put lead in paint. I remember as a kid, I helped my father solder. We built our house, right? But I remember soldering pipes, and I remember my dad saying, this new solder out, and this is back in the 70s, and this new solder out, some of you are like, oh God, he's old. But anyway, in the 70s, I was a little kid, and I was helping my dad plumbing, but he said, there's this new solder out, and it doesn't have lead in it. Well, that's stupid because it's so much harder to melt. And he goes, well, it's a good thing I've got the old stuff. I've got plenty of supply. Well, lead in copper pipes, ladies and gentlemen. Any home built before 1980, and this was probably in the 80s, this happened on the 70s. I'm just throwing out numbers. Probably 80s. Man, you're getting lead. You are getting lead from your pipes in your home. If that house was built before, I don't know, sometime in the 70s, 60s, 50s, whatever, there's lead. Every little piece of pipe is put together with lead solder, and it's possible you're getting lead. And if you absorb that lead, you can get anemias, you can get neurological defects. It's extremely important with little kids. And then and organic solvents, and what we're talking about is organic solvents, is like acetone and paint thinners and gasolines and diesel and that sort of thing, yucky stuff. But you shouldn't get that on your bare hands, and it can really cause a lot of problems with your with your body there. Anyway, I don't even know what all of them are, to be honest. I have to stop and think for a while, but I'm trying to get this done. Okay, so body temperature regulation. Okay, again, if you're cold enough, you're going to cause the signal to be going to your muscles to contract in these shivering environments. And if you shiver, the muscles generate heat. And when you generate heat, the blood passes by the heat, muscle, picks it up, and then the heat will transfer everywhere. That's what shivering does. But the others are just sweat. Sweat cools the body. It says if the body temperature rises, you have dilation of the blood vessels. It can increase sweat to the skin. 3 gallons of noticeable sweat to cool the body. Gallons? 3 gallons? Wow. Set 3-gallon jugs out and take a look at that and thinking you're sweating that much in a day. You better be drinking, because if you're sweating out 3 gallons, that's a major loss. So that's why in hot temperatures, you need to drink more water, especially out there in the wild, wild west. You go for a walk and you're like, I didn't even sweat. It's because it's so freaking dry in the air. You don't even realize that this will evaporate. You can go for a mile run. You don't have a drop of sweat on you, right? And it's because it's evaporating. So you have to continue to drink water, so you'll get dehydrated quickly. All right, and then when it's cold, your blood gets shunted away from the skin, and the skin temperature will drop in the cold due to that passive heat loss and also the vasoconstriction environment, and you can have damage like frostbite, right? And you can lose fingers and such. All right, feeling. Let's talk about this. Meissner's corpuscle. What I tell my class in person is, you feel a little bug crawling on you. You don't even see it. You feel a bug crawling on you, and you're like, oh my, I feel something. But I go, oh, Meissner's, there's something on me. And the Meissner's corpuscle can feel the littlest bit of pressure. The deep pressure is lamellar, but I call it Pacinian. And this is like, it says a deeper pressure. So I think if you go up and poke somebody, poke. Hey, don't poke me. You are Pacinian me off with my Pacinian corpuscle, because it's a deep poke or continuous pressure, and that's what feels it, the Pacinian corpuscle. We talked about hair follicles already. Stimulus that is painful is free nerve endings, and any of these can feel pain, but the free nerve endings will also feel pain first, and so we see those free nerve endings right there. Actually, I think that's a Meissner's corpuscle. It's so small I can't see it, but that's the Pacinian. You see how much deeper it is, deep. Meissner's are close to the surface, free nerve endings close to the surface. All this is dead tissue anyway, so it's only in the dermis, right? In the dermis. All right, so vitamin D, we talked about vitamin D. I said that without vitamin D, you can't absorb calcium. That is true. So keratinocytes can activate some hormones, and so you get the skin come in, and we can convert this to vitamin D, the active form. Skin makes collagenase, which helps turn over collagen to prevent wrinkles. But as you age, it gets worse. About 5% of your blood goes to your skin, and the skin holds about 5% of that as a reservoir. The vessels, as we said before, we can constrict them to push the blood back into the body, or you can vasodilate them, and you will sweat quicker. Skin can be secreted in limited. I'll try this again. Can I try it again? I'll try. Skin can secrete a small amount of nitrogen waste, ammonia, urea, and uric acid. I don't know anything about that, to be honest with you. I don't know why, who, what, where, when. And I've been teaching this for a long time. I know that it does, but I don't know why, and I'm not even sure how. But I assume the only way is from sweating. But I know this. You go out and you sweat a lot, you're going to lose water. And everything, it says salt. How do you ever prove that? Anybody that's ever went outside and sweated And then later your shirt dries or your hat dries or baseball hat, you'll see a little white layer. That's the salt. Isn't that wild, right? Skin cancers, let's talk about them. There is 1,000 different things can cause this, and that is exactly what they say, right? So many external diseases reveal themselves on skin. You could see those all kinds of weird coloring and rashes and things, and you know something's going on. The most common skin disorder is a bacterial infection, yeast infection, or possibly viral, but the most common bacterial. Less common, but more damaging, burns and cancer. So let's talk about burns and cancer here for a little bit. The number one cause of cancer is overexposure to ultraviolet radiation. And that sucks because I love going out to the beach and having warmth on my skin, right? But frequent irritation of the skin. Something's irritating the skin and ultraviolet radiations. So skin lotions contain enzymes that can repair damage. They get very expensive, obviously. But here's the three major types of skin cancer: basal cell, squamous cell, and melanomas. Let's take a look at that. So the basal cell carcinoma, which probably is going to be on the test, is the least malignant and most common. It's 80% of skin cancer cases. This is the most common, but the least malignant. What does malignancy mean? That means it's going to go to another part of your body. Well, you don't want that. So, but this one is basal cell. This one's probably the one that is most common. You see 80%. And so you have the greatest chance of this. It's a slower invading and a slower growing, cured by just cutting it off. They cut it out 99% of the time. You're good to go after that, right? Here's an example of that. We see skin cancer right there, and that's on the nose. You can tell because there's eyeballs there, and there is a nose, and you can see the baggies of the nose. All right, but all jokes aside, this is a big deal, and a lot of people see that and they're like, but that's skin cancer. That's a bummer, right? And then we have the squamous cell carcinoma. This is the second most common. It can spread to other things. And this will kill you. This will kill you. You have metastasis to another organ, that'll kill you, right? This one, you treat it early, you got to go. But this one, it can kill you, right? I had a doctor friend, and I said, "Hey, doc, I don't say his name, but he had a brown looking. What's this? This looking deal. It's kind of weird looking." I said, "Hey man, you need to get that. You need to get that looked at." And it was only the size, ladies and gentlemen. It was the size of a pencil eraser. Like if you took a pencil eraser and just stuck it on his head, that's the size of it. Not the thickness, the roundness. He was dead in 3 months. I'm not even kidding you. 3 months. It has already metastasized. It was on his forehead. It metastasized to his brain. Killed him. Went in his brain, his lungs. Within 3 months, he was dead. This is crazy. You got to get this looked at right away when you see this. So it looks as a scaly, reddened papule on the scalp or the ears or lower lip or hands or something like that. He had it on his own forehead. Is where he had it. You need radiation therapy and surgically removed. If you catch it early, you got to go. You got to go as quick as you can on get these things off you. And this is probably the most dangerous one here. It says it's the cancer of the melanocytes, and definitely this is highly metastatic and it's resistant to chemo. Luckily, it's only about 1% of all the cases, 1 out of 100. But they have to cut a big chunk out of you. They got to do radiation. This will kill you. Melanomas will kill you. They're the worst. You don't want that, right? And this one's already black. It's already dead skin. They gotta chop this whole ear off right there. You don't want that. A, B, C, D. Asymmetry. All right. Let's talk about that. Is this a perfect circle? No. Look at it. It's like a kidney bean shape, but then it kind of goes out in here too. Look at the symmetry. It's not just perfectly round. It's just this. This is what makes it weird here. It's not a perfect circle. All right. So asymmetry. The two sides of the pigmented area do not match. You see that? Two sides don't match. There is the border irregularity. That's the same thing. Indentions. What the hell? That's rotting is what that is. But see that indention? See the indention right there? That's the indention, right? So it says, oopsie, it has indentions, right? Color. Contains several colors. Black, brown, tan, sometimes red or blue. Yuck, right? See the different colors? Black, red, kind of brownish over here, yellowish there. I don't look like, I don't know, maybe not. Colors there, but it had to number. Diameter. Larger than 6 millimeters. Size of a pencil eraser. That's exactly the size of my buddies, right? You're dead in 3 months. Evolving, or it changes, gets bigger. It makes different shapes or sizes, A, B, C, D. So sometimes E, they ship it A, B, C, D, E, right? Evolve. I don't know why they stop at D. Burns, talk about beans. Now, here's the weird thing. Yeah, there's a kid the other day, he said, we were riding motorcycles together, and he goes, yeah, I got a 4th-degree burn. And I was like, that's the dumbest thing I ever heard. Never heard of 4th-degree. So I quickly Googled it. There's apparently a 4th-degree burn. So I want you to Google 4th-degree burn. I did not know. The book, we don't even teach 4th-degree burns. It was on Google. It was on Google. And I was like, what is a 4th-degree burn? But a 1st-degree burn is just locally red. That's like a sunburn. It's just like a sunburn. You might swell. It hurt a little bit. Right? It gets a little red. 2nd-degree burn, you can get blisters. Right? 1st and 2nd-degree burns are referred to as a partial thickness because it only goes through the epidermis and maybe the epidermis. But a 3rd degree, it says it's the entire thickness, referred to as a full thickness burn. The skin will turn gray or white or cherry red or even black, or it just disappears. But a 4th degree, apparently, like burned, is just eats right through all the it eats right through. And I did not know there was a 4th degree. I'm a very educated man here. And I was like, we don't even have it in the Pearson book. Unless Google's giving me some kind of weird thing here. I never saw it. But skin grafts, sometimes to fix this, they got to take skin from somewhere else because it ain't coming back. No even swelling because you even killed the freaking ability to swell, right? This is called a rule of nines. So you break the body in 11 sections, and then you either, it's like a half of a 9 or twice of a 9, that sort of thing. Your genitalia is only 1%, but if you hear, they were burned on 18% of their body. What does that mean? Like the front here, front there kind of thing, right? So what we got is the head's 4.5%, arms 4.5%, trunk is 18%, 9 here, 9 here. All right, so let's add that up, right? So you got the front, the back, and the neck. So front's 4.5, back's 4.5. That's 9. All right. So you get the front and the back of the limbs. So you got 4.5 here, 4.5 there. It's 9, 9, 9, 9. That gets up to 18. Front of your body, 18%. Your back, 18%. So that adds up to 36. 9% here on the back of the leg, 9%, 9%, 9%. Okay, so you get 9 times 4 is 36. Burn off your stuff, right? 1%. There's 100%. So it adds up to 100%. So rule of nines plus 1, 100%. Now, here's the scary thing. This woman went into McDonald's, burnt herself with coffee. And you're like, oh, she got like 36 million bucks. Well, I'll dump coffee on myself for 36 million bucks. No, ladies and gentlemen. Think about this for a second. This coffee was so freaking hot. It was like boiling water. We ain't talking coffee. We're talking boiling water dumped on her girl parts. She had 3rd-degree burn. That ain't worth $36 million to have a 3rd-degree burn on my area. And it wasn't just normal coffee. They were handing her like boiling water kind of thing. Now that brings up an important point. Microwave water can get hotter than boiling water. That's scary, right? So here we have a 2nd-degree burn. That's 3rd-degree burn. I don't want no 3rd-degree burn. Now 4th is like eats through the meat too, apparently, according to what I looked up. Yuck. No, not good, right? Goes to the bone kind of thing. All right, so how do they treat a burn? Well, 25% of the body is a 2nd-degree burn. That's critical. Critical means it could kill you, right? If you got 25% of your body with 2nd degree, if you got more than 10% of your body with a 3rd degree, it can kill you, right? Your face, your hands, your feet bear a 3rd-degree burn, for example. You can die. You can actually die. So they have to cut that all that skin off. They got to get you on an antibiotic. They can put you on IV. Why an IV? Why an IV? Because you're losing fluids with this burn. You're losing fluids quickly. But they got to put you on an antibiotic to prevent the infection that's getting ready to kick in. And then they got to cover it with a temporary covering, and then they got to replace it and keep replacing it. And when they take this covering off, those patches, it can pull off other skins. Extremely painful. Skin grafts means they might cut it off your leg to put it on your face or something, and they got like donor skins kind of thing. All right. It's just horrible, right? It's just bad. I never teach embryologic or developmental aspects. This is not an embryological course, and so we normally just remove that. I'm not going to cover that. I never put it on the skin. Test, sorry. But how to delay aging. The skin's important. But I met this young lady. She was, I don't know, 80-some years old, and she had amazing skin. And I go, how do you do that? She goes, I never go in the sun. I moisturize daily, and I drink a lot of water. And I think that advice was amazing because this lady looked like she had skin of a 40-year-old that didn't even go in the sun. She's just defying aging, right? Ladies and gentlemen, it's a pleasure to cover this chapter for you. Hope you have a wonderful one.